think the ultimate goal is to ensure stability for the child.
We have a responsibility also to the other young people that we're thinking a lot about matching because it is their home.
I really value meeting with young people, experiencing them for who they are rather than who somebody else perceives them to be.
Hi, my name's Dr. Paula Corredor Lopez and I work at SuperCare and I'm a consultant clinical psychologist.
Hi, my name is Dr. Laurie Preston. I also work at SuperCare and I'm a clinical psychologist.
And we were going to talk to you today a little bit about the referral process and when we get involved with the assessment part, which is often long before a placement might start. You get someone like myself or Laurie involved in meeting with a young person to try and figure out what their needs are and how we can best meet these in placement. It's it's a new company, so it's a relatively recent thing that you and I have been involved in referrals and assessing young people before they come into placement with us. Mm-hmm. And we see a lot of young people in various different settings. So maybe we start with explaining a little bit about where people are coming from and how we might start an assessment.
Yes, so we actually meet young people in various different settings. So sometimes children can come to us from home. So not all of our young people in care are care experienced when they come to us. So we might meet with families and young people at home. We might also meet young people in inpatient settings. So if a young person has been sectioned recently due to a mental health crisis and they're being discharged into a community residential setting, then we will go and meet them at the hospital to try and understand their needs and how best we can support them in the community. We may also meet young people in different residential settings, so for whatever reason that placement wasn't suitable for that young person, and there's a real kind of push to try and keep children local to their communities and their families. We always try and meet people and place people as close as we can. So various different settings where we can meet young people. What do you think is benefit from getting involved in the referral process? Why do you think we offer some benefit there?
I mean, particularly coming from a different set of training, a different set of experiences, we can add value to the assessment because we know a lot about potentially some of the mental health difficulties that young people might be presenting with, the challenging behaviour, having a sense of what's possible in what kind of environment, and then thinking about how that might be enabled in the environments that we work in. What else can we add to add richness and quality to this young person's life? And how might we do that? We're also, while we're there, we're looking at how the staff are working with the young person and thinking about what we might want to emulate, but also what we might want to try additionally, because there'll be good things that have happened or good ways, best ways of working that have reached the young person wherever they are currently, and we might need to keep some of those because some of our young people, if they've got an autism diagnosis, for example, quite like routine and sameness and order and predictability, and so in order to bring somebody over to a different kind of care experience, we might need to emulate some of the aspects that they'd had and their norms at the previous placement or at home. Mm-hmm. So us having a really good picture of that is very important because it means that we can literally hit the ground running with the support that they need in their next environment, because changing a home is difficult for any of us, right?
Absolutely.
And so if we can do that in an informed way, if we can be prepared, if we can sort of pave the way as gently as possible, then that's what we need to be doing. And I think that's the value of having us there, another pair of eyes, another potentially skilled pair of eyes at times, insightful, helping build rapport with young people so they know who they're going to meet when they get to the setting, mm-hmm. and what kind of things they can ask any questions, what kind of things we might be doing with them when they move into the SuperCare home. So yeah, that's how I see the assessment working well.
Yeah, and I think the ultimate goal is to ensure stability for the child as well. I mean, we know that some of the children that we support have had multiple placement breakdowns, maybe 12, 13, 14 placements that haven't been suitable for the young person. And I think we know the impact that that can have on a child's sense of security, stability. They need that consistent caregiving experience. And so when we are assessing young people, we are thinking, are we the right provision for them? And not just about whether that child can access support through us, but can we give them the support that they need? When we receive referrals for young people, it's very, very difficult to get a sense of what that young person is like, what their traits are, their personality, their values, their strengths from a piece of paper. And because we have to be informed about risk, we tend to find that referral forms lean towards highlighting risk. And so it's really important for us to go and meet with the young people and actually get a sense of who they are and what matters to them. And sometimes we find that the referral forms maybe don't highlight the level of risk that the child might present with. Oftentimes children who are in residential care have experienced trauma, neglect, criminal exploitation, and so these are things that we have to think about. So yeah, it's really difficult to get a sense of who a young person is just from a referral form. So I really value meeting with young people and just experiencing them for who they are rather than who somebody else perceives them to be.
We have a responsibility also to the other young people that are living on our homes, that we're thinking a lot about matching them. Well, how will they fit together? Because it is their home. And we have, there is an expectation that, they're living together like a family, and family members don't always get on, but for the majority of the time we need for it to be as settled as possible for everybody in the space. So we are also thinking with a matching lens as well, which of course you can't necessarily do just with the information that you get on paper. You've got to see the very lived experience of how it is to be with that young person, how they engage, what their likes and dislikes are, their preferences, what their hopes are about where they live next, all those things. And then also be holding in mind the other young people that are already in the placement.
Absolutely.
And how the fit might pan out.
Yeah, and I think residential care can sometimes get a bad rap, but what I've seen and what's been really beautiful to see is the relationships that young people build within the homes. There is a real kind of sibling-like relationship. So I'm just thinking about some of the young people in a particular home within SuperCare. There are 3 of young people in the home, and they love spending time with one another. They go on holidays together. You can really see that connection and that bond. And sometimes children haven't had that experience of family connection and closeness. So actually it's really wonderful that they can connect and bond with so many people and take a real kind of community approach to care as well. There's a really lovely saying about it takes a village to raise a child, and I think residential care feeds into that a little bit. It kind of engages in that idea of we've all got value to bring in how we support these young people. So yeah, it's a real community connection.
When I started at SuperCare, I was really struck by how we had these embedded therapy teams, and I'd visited, having worked in social care for many, many years, decades. I was also mindful that I hadn't necessarily seen this in other spaces, and working in it and also starting the process even before placement has started has really opened my eyes to actually how care placements can be done well, and how beneficial it is that we start the relationship building before they've even come into our placement, so that we can really be there and start the work as soon as they're home. So I'm just thinking about what we bring to that as psychologists, but it's not just us, is it? It's also occupational therapists, and it's speech and language therapists, behavioural specialists, and soon to be other members of the team who we'll be bringing on board. But you and I there, bringing the psychology lens to the spaces as well, straight off the bat.
I heard about a really wonderful interaction that you had with a young person that you assessed recently, where the young person was feeling quite anxious and dubious about who he was meeting, and instantly you connected with him and gelled with him and bonded over Pokemon, was it? Something?
I think we might find that was Sonic.
Sonic the Hedgehog. And I think just bringing your authentic self and your humanness to the young people is so important as well.
Yeah.
It's a really stressful process for both the child, the family, and professionals involved. Everybody wants to get it right. So you find that sometimes people come with quite a stressed or nervous energy, approaching really difficult conversations about placements. And I think what's nice about having the therapists inform on placement allocations as well as management is together we can have a shared kind of understanding and agreement of the child's needs, and it just relaxes everybody a little bit.